Hey all, I'm Dr. Abdul Tawfiq, and today I'll be presenting a topic called leprosy, also known as Hansen disease. It is rare in many developed countries, including public health concerns. Several parts of the world it has been getting affected, including India. Now we'll focus on pathology, types, complications, and most importantly, how the physiotherapists play a crucial role in the management and rehabilitation parts. Shall we start? Leprosy. Leprosy, it is a disease, chronic infectious disease caused by Mycobacterium leprae. It spreads slowly and affects the colder areas of the body. This is why we often see it affects in the hands, nose, ears, feet, etc. It has special tendency to invade Schwann cells, which are responsible for insulting peripheral nerves. Over time, this leads to nerve damage, loss of sensation, and muscle weakness, often resulting in disfigurement if left untreated. Leprosy present in two major forms based on the immune response. What are they? One is tubercular leprosy and lepromatous leprosy. What is tubercular leprosy? A tubercular leprosy is an immune system response well, so bacteria may get fewer and get infected to the body. These patients usually have 1 to 5 types of skin lesions, and the test procedure may get B negative. What is lepromatous leprosy? This is more severe than tuberculosis. The immune system fails to control the infections of the body that leads to widespread lesions and nerve involvement get damaged. These diseases spread through airborne droplets from the nose, often infected person, or prolonged contagious but chronic exposure in a poor hygiene. These conditions can lead to neuritis. What is neuritis? It is an inflammation in the nerves that causes severe functional involvement. Neuritis is the most common neurological complication of the patients where experience nerve pain, tingling, eventually muscle weakness or muscle pain. In some cases, nerves become so swollen under the skins. Actually, it feels under the skin like what is like it is like a swollen tube. Especially these neuritis can affected in the leprosy as ulnar nerve and peroneal nerves that leads to certain deformities. Uh, Coming to the management of this neuritis, in acute stage, we control inflammation using multi-drug therapy and steroids like peridosonal. These can stop the damage early. In the chronic cases, nerve damage may become permanent and the surgical decompression like neurolysis may require. Physiotherapy is an essential to all stages for splinting, mobilization, and pain management. Then muscle paralysis and epilepsy. When motor nerves are get affected, muscle become weakened or paralyzed. This result to the classical deformities. What are the classical deformities? Claw hand, wrist drop, uh, foot drop, such as these patients can develop abnormal patterns, gait patterns, or become unable to perform their basic tasks like gripping the object, paralysis, and management conservatives. Splint supported weakened muscle and maintain hand or foot position. A electrical stimulation can slow down the muscle atrophy. If conservative treatment fails, we consider surgical procedure like tendon transfer to restore the function. Example, brand tendon procedures for claw hand. In the post-operative functioning, physiotherapy is a key to strengthening and training neuropathic ulcers. What is neuropathic ulcers? Loss of protective sensation leads to unnoticed injury. Patients may develop blisters or ulcers, especially on the pressure points, like the sole. These are often infected but painless, making them worse. What are the management in this? Footwear and offloading, etc. The prevention is better than cure. Like patient must wear protective shoes, check their feet daily, and keep them clean. If the ulcer do develop, we use total contact cast, offloading, and antibiotic. The chronic ulcer may require scar extensions or surgical corrections. The deformities are Clahan deformity, Abdom deformity, wrist drop, and foot drop, and econovata symptoms. When the paralysis and repeated injuries of combination deformities from the overtime, joint become fixed tendon contract, and the scar from these causes functional disability. We use multi-tech therapy for vocabulary cases. The course of 6 months for the multibacillary. It is extended to the 12 months. These drugs are free under the National Leprosy Program. Now, what is it? Leprosy is a curable disease, but the complications are preventable only if we get early detections. As a physiotherapist, we play a crucial role in rehabilitation, educating the patients, and deformity preventions. Now, hope you all understand the leprosy's topic. And once again, thank you for listening. Have a nice